Hi, I'm Peter Boland, and welcome to today's podcast. In this episode, I'd like to focus on the state of Hawaii, the whole state. It's a multi-pronged initiative that provides a lot of learnings for everyone. The scope of the project is simply enormous and well worth a deep dive into why the study is such an important initiative. It's the most far-reaching initiative in the case studies handbook and one of the most consequential. It directly impacts the well-being of everyone in Hawaii. It wouldn't be an overstatement to say that the state's future literally depends on the success of meeting the major objectives of the initiative in each island, each of the 5 islands. The case study certainly broadened my thinking about equity as, quote, a big tent concept and how it applies to every aspect of daily life. So right up front, I want to highlight the 3 main takeaways of the Hawaii Community Foundation's work. The foundation cited 3 things above all. First, transparency, trust, and collaboration are necessary to achieve equity objectives, shift power, and build mutual accountability with diverse partners. Second, cultural competency of providers is necessary to build community trust with healthcare institutions. Third, community leaders need the active support and the political leverage of anchor institutions to accelerate local and statewide changes. Now, while these takeaways don't seem highly unusual or particularly over the top, how they apply to everyday life and all parts of Hawaiian life are remarkable in scope and in terms of cultural context. The deeply held cultural values and sacred practices of Hawaiian life. And I'll give my own comments at the end on how I think these findings can be applied equally to any state initiative around the country. And the Hawaii Community Foundation study looks at what an entire state's take is in relation to equity, and health equity in particular. It's a big tent concept. The big tent concept means covering just about everything that impacts the daily life of residents, including tourists, because tourism is the main business and the lifeblood of Hawaii. And the impact of water and natural resources is profound. It explains why so much of what makes Hawaii Hawaii also threatens the physical and cultural health of all its residents. And oddly enough, I was very curious about why Hawaii is nationally ranked #1 in terms of access to care, quality of care, and overall health of the population. That really surprised me because I know firsthand, and as a researcher, that the state has pervasive health challenges. The state-by-state national rankings process simply overweights access to care, which in Hawaii is unusually high compared to other states. And this is due to an unusual historical fact. When Hawaii first became a state, part of the compact with the federal government was that Hawaiians were guaranteed full health care coverage, which in turn was responsible for such a high rating on the access to care score. Now, the case study reflects the deep concern of the Hawaii Community Foundation and why it funded an in-depth analysis and a roadmap for how each of the 5 islands can face life and death issues going forward. It awarded more than $7 million to 105 nonprofits to address systemic inequities throughout the state through a deliberative change framework. And each change framework stands for 6 sectors, each of which have a profound impact on the health of individuals and families living on each island. Each letter refers to a particular set of initiatives. C stands for community and economy. H, health and wellness. A is arts and culture. N for natural environment. G, government and civics. And E stands for education. So let's look at each sector and some of the highlights of the foundation's biggest concerns. First, community and economy. The section pointed out, although the economy is growing, driven by tourism, wages haven't kept up with the cost of living. Per capita average incomes just below $69,000 a year, but with only 38% of jobs paying a living wage at $20 an hour. Single adults earn $35,000 and 29% can't cover 3 months of a financial emergency. Single adults, average survival budget is $28,000 and $77,000 for a family of 4. Yet 56% are renters. And a single family house on Maui costs just over $1 million. And last year, the housing deficit was almost 14,000 units. For most, 30% of income goes to housing. Now, in the second sector, health and wellness, point to a whole range of social determinants of health for each island. Food security applied to 11% of the whole population, with over 6,000 persons being homeless or unsheltered, and 2,500 children living in foster care. 45% of adults had a serious mental illness or behavioral condition, and 30% of students experienced depression. Yet there's only one mental health professional for every 430 individuals in Hawaii. Child care and after-school programs are offered to essential workers. And one of the program highlights is called the Promising Minds Initiative that increases healthy development of vulnerable children ages 0 to 5. The purpose is to build resilience in children and families experiencing the effects of trauma. And the funding was for training trauma-informed professional development programs in the workforce, such as social work, counseling, behavioral support, pediatricians, and nurses. 31% of Hawaii's children are at risk for exposure to trauma. 20% experience 2 or more adverse childhood experiences, also called ACEs. Domestic violence is experienced by 52% of the population. 48% for emotional abuse, and 30% for sexual abuse. The third sector is art and culture, which emphasizes nurturing Hawaii's diverse culture because it depends on supporting arts education, and especially for youth. And 20% of Native Hawaiians, 18% of non-Hawaiians take part in Native Hawaiian cultural activities. Now, this is important. The total economic activity generated by the arts and culture sector is a whopping $206 million a year, which supports 6,000 full-time jobs. That generates an important ROI by any standards. So the arts and culture sector advances equity as well as preserving and furthering traditional cultural knowledge and wisdom. Now, the next sector holds, I think, is the key to sustaining equity in the state. It's natural environment and a top priority. For centuries, Hawaii maintained a tradition of fresh water supply being held in trust for citizens compared to water as a private property right. And this begs the question, who owns water and why? Hawaii's long-term water supply faces a very uncertain future because water is wealth, and the community is only as strong as its wealth. Water is the critical element for the community to survive. It's that basic. It was agreed that water conservation is the least expensive and the most efficient way to increase available water supply. A blueprint for change was developed to guide investment and actions to create an additional 100 gallons of fresh water per day by 2030. And that's not that far off. This assumes 6 things: reduced rainfall, increased drought, land use changes, increased evaporation, as well as increased population pressure and an aging infrastructure. And shared consensus was absolutely vital because water is a complex issue that demands a comprehensive set of solutions with access to accurate data to support wise decision-making going forward. And solutions are going to have to focus on three key factors: financial stability, cost effectiveness, and targeted education efforts across the whole population. And as the report pointed out, the true cost of water doesn't reflect its true cost. And the cost of freshwater supply will rise with each year of delay. So the nexus between water and energy is both clear and compelling. The fifth sector, government civics, had only 9 organizations apply for funding, and grants range between $30,000 and $50,000. However, schools were found to have the greatest potential to increase civic engagement. And one of the grants recognized that suicide prevention extends far beyond mental health and incorporates gaining skills and social support networks for addressing adversities in life. The project set goals, such as creating safe places for youth and increased access to after-school programs and a community awareness program. And to increase grant-making participation, the foundation also developed a very innovative trust-based philosophy, a new approach that builds more equitable relationship with nonprofits in the state. It aims to advance equity through multi-year unrestricted funding that gives more flexibility to nonprofits to carry out their mission. And one of the most important learnings was to streamline the entire grant-making process. It was far too bureaucratic and stifled participation. Paperwork would be simplified to only ask 4 questions. And the online interview process would enable applicants to ask the foundation questions, which leads to more constructive two-way feedback. Now, in the last sector, education, the foundation recognized the need to improve access to early education. 54% of 3 to 4-year-olds are not involved in early education programs. Now, at the other end of the age spectrum, the Stronger Together Hawaiʻi Scholarship Program is a $2.4 million fund with over 360 students receiving an average of $62,000 for tuition and education costs, with many being families to attend college for the first time. So with that summary, I'd like to segue into the second part of the podcast, which is my commentary on the case studies and what transferable lessons can be applied to any location, because transferable knowledge, it applies anywhere. Local initiatives can be framed as a balance between generating more health as well as focusing on specific determinants of health. The latter may or may not correspond to the root causes of poor health. The root causes are more challenging to deal with because they encompass factors like cultural change and what stewardship means and mutual accountability. Each of those can be challenging. Removing structural barriers to better population health requires partnering with the community and acknowledging that the expertise for solving these challenges lies in the community rather than in hospitals and delivery systems. It lies in the community, not in hospitals or delivery systems. Everybody is a partner, but fundamentally it lies in the community. And this includes co-designing and implementing each pathway. The Hawaiʻi Community Foundation remains very committed to preserving and furthering local culture as a context for the change initiative. I want to emphasize the word again, context for change. The foundation recognized and honored cultural traditions and values as cornerstones of community health, as distinct from healthcare services and clinical care. And health is a deeply shared value, and community cohesion is a determinant of outcomes and sustainability. Language, faith practices, and mutual aid are each core health assets and not secondary to care delivery, especially in Hawaii. And said another way, Equity is a core operating principle. It's not just a bolt-on characteristic of a strategic plan. And Hawaiian culture is embedded in specific cultural beliefs. A few examples. Responsibility represents not just responsibility, but right and stewardship, and the reciprocal relationship of caring for the environment and the responsibility to act on behalf of the community. That's why any hospital expansion effort could include co-sponsoring community spaces where legal aid and behavioral health and food programs and primary care can all be offered under one roof. It points to area-wide partnerships co-developed with dozens of civic partners committed to improving local health status. And each delivery system could commit to specific core community values, whether it's dignity or belonging or social connection and stewardship, and make those key parts of any local initiative. Another Hawaiian concept is around balance and the extended family. It's based on compassion. We can think more broadly and expand each of these concepts, for example, well beyond whole person care to include whole family care, which is a more realistic view of how health is maintained and how illness is spread in the community. Local communities can best pinpoint where and how investments can be made in social health infrastructure and build community cohesion around shared goals, which are essential building blocks of sustainability rooting in community culture. And I want to emphasize the role of cohesion. It is a principal building block and an endpoint. And health equity is a whole of community responsibility. And that's how Hawaii looks at equity principles and how they apply to all aspects of community life and society. We can learn a lot from Hawaii and how equity values are deeply rooted in local culture and everyday life. And I'll leave you with maybe one observation. When I began researching this case study, I thought it would focus primarily on health and healthcare services. And I didn't realize it was going to focus on water too, and the critical role that water played in everyday life, and the foundational role that culture has on everyday health as well. Both are essential to Hawaii's sustainability. The case study broadened my thinking and awareness about the context of health equity in everyday life, no matter where we live and our sense of place. In Hawaii, without adequate rainfall, without adequate groundwater reclamation, any assumption about Hawaii and health would be way too narrow. There'd be no Hawaii because sustainability and prosperity are so closely woven into equity and culture. And that's a lesson we can all learn and relearn time and time again. Health and health equity is part of an ecosystem of human values and deeply held cultural traditions. So in closing, I think it's worth asking, what are our personal values and the cultural values we each bring to your beliefs about equity, place, and prosperity, sustainable prosperity? And every community has their own unique set of water issues, and that sustain and define local culture. And we need to be more explicitly aware of their importance and their impact. So that's my takeaway for the day. And thank you for being part of the podcast today as well. I'm Peter Boland.